Hello, I'm Dr. Mickey Sharma. I'm the Director of Student Life's Counseling and Consultation Service. And I'm going to take a few moments to talk with you about student mental health, the importance of taking care of your mental health, and all of the different resources that are available at The Ohio State University to support students' mental health. Your mental health and well-being is an important part of what helps you to be successful as a student. Mental health and well-being is also a part of safety. I think we all realize that if we don't feel physically safe, we may not feel emotionally safe. However, the reverse is also true. When students are not feeling emotionally safe, they also cannot feel physically safe. So making sure that you're giving the needed attention and support to your own mental health and well-being can help you be successful as a student at Ohio State. The number one concern that students present to the Counseling Center is struggles with anxiety, stress, tension, when people are just clenched up and they just feel overwhelmed. That's the number one concern that students bring when they come to CCS. There are many concerns, though, that a student might be struggling with. While anxiety is the most common, depression, struggle with relationships, academic concerns, having experienced a traumatic or very upsetting event, having problems with family, concerns about your identity, eating or body image related concerns. There are many things that students struggle with. And if you're having one of these struggles, I promise you that there are other students who've had similar struggles and there is help available on campus for you. Because of the size of our campus, we offer what we term multimodal resources. What this means is we look at the unique background and needs of each individual student, then we match them with the right support service. And in doing so, we certainly keep in mind the unique characteristics of each student and pay attention to diversity and multiculturalism to make sure that we're providing services in a culturally competent fashion for all students on our campus. As I said, there's a wide range of concerns that students have, and I'm going to walk through those for you in three different categories, looking at mild, moderate, and severe. And that can help kind of differentiate what am I struggling with and what might be the right resource for me. So when students are having more mild concerns, this might be a point where I'm just feeling a little stressed out, I'm having some trouble getting my work done, I miss class on occasion, I'm having difficulty getting connected to campus, I'm not feeling like I'm adjusting well to the university or maybe this country or making friends, I'm procrastinating. If some of this sounds like what you might be struggling with, there are many resources available to help you on campus. Through CCS, we have drop-in workshops and the Let's Talk program. I'll talk more about those in a moment. The Student Wellness Center offers wellness coaching. There are support services in the Youngkin Success Center, including the Dennis Learning Center and the Buckeye Careers Center. The Wellness app is available for all students, the OSU Wellness app, and I hope that you've already downloaded that. And those of you who have an iPad through the digital flagship, it's been downloaded onto the iPad for you. Moving on to moderate concerns. If you find that you're missing class a lot, you're having significant increases or decreases in your sleep or appetite, there's a significant increase in the amount of alcohol or substances that you're using, you're having anxiety attacks or panic attacks, I'm having frequent crying spells and I don't know why. I'm not taking care of myself, I'm neglecting my day-to-day daily needs, or my mood shifts are significantly interfering with my life. When students ask me at this point, how do I know if I need to reach out for assistance? If what you're struggling with is impacting your day-to-day ability to meet your goals, then you should reach out for help. Contact CCS through our consultation phone consultation, which you schedule online through our website at any time you schedule it, and then a clinician will call you during that scheduled time. And then if we talk about severe concerns, at this point, if a student is engaging in violent acts or having angry outbursts or uncontrollable mood bursts or having thoughts or actions about threatening themselves or others, are they just not able to take care of themselves or able to communicate clearly? It feels like they're just not in touch with reality at this point in time. We want to think about safety first. And if someone's at that severe place, we have the Wexner Medical Center and the emergency department where any student can go for assistance. The OSU PD can also provide assistance. The officers through OSU PD are basically all CIT trained, which means they can assist in crisis situations and look at how to provide the best safety recourse for a student who's really struggling. Finally, at CCS, when we are closed after hours, over the night, through the weekends, 365 days a year, if you call our main number and push number 2, you will get patched into a live counselor and you can get mental health support after hours as well. All the resources I've talked today are available at our website, which is ccs.osu.edu. We have 2 main locations, at the Youngkin Success Center and Lincoln Tower, as well as embedded clinicians located across campus. I encourage you to use the wide-ranging resources available at The Ohio State University. Take care of your mental health and well-being. Learn skills that will help you be safe, be well, both as your time as a student at Ohio State and as you move forward and launch your career and wherever you may go after you finish your academic career. Thank you.